Hello, welcome. I want to use this opportunity to appeal to parents who have children that are not meeting up with developmental milestones yet. I want to appeal to them that as soon as you notice that your child is not meeting up with developmental milestones, please go for developmental screening and further for a diagnostic assessment. Parents will say, for some reasons that looks valid, I don't want to take my child for diagnostic assessment because there is no money. It looks quite valid, right? However, some other parents will say, because of the stigma, we know there is stigma out there, but when you look at the advantage of going for a diagnostic assessment, you would want to go for a diagnostic assessment and ignoring the stigma out there. However, we are making sure that we are creating more awareness for people to know that not meeting up with some developmental milestones is not a disease. Yes, it's not related to any disease at all. Furthermore, some parents will say because of the myths associated with developmental conditions, that is why I don't want to take my child for developmental screening. Because of the misconceptions out there, that's why I don't want to go for a diagnostic assessment. However, what about if you look at the advantages of going for a diagnostic assessment, such as the child will have access to professionals who can work with this child, who can meet the needs of this child. And this is because they already know that this is the condition the child has and this is how to address it. That's an advantage for the child. That's an advantage for going for developmental assessment, developmental screening, or diagnostic assessment. Another advantage is that you will understand the child yourself. You will know what exactly is wrong with the child, and you will know it will lead to a level of acceptance. You will now begin to accept this child that, this is this child. I'm accepting you for who you are. I've understood your condition. But if you don't go for developmental screening or a diagnostic assessment, you might not know the child's condition, and you might not understand the child's condition, and you are not likely to do the right thing or even accept the child. Furthermore, when a child goes for developmental screening or a diagnostic assessment, the school will plan adequately for that child. We do everything to accommodate that child because they now understand the child's peculiarity. They know that this is the condition and this is what will work well for this child. This kind of environment will accommodate children with such neurodevelopmental conditions. Furthermore, when you take your child for diagnostic assessment, the child is likely to get early intervention. When there is early diagnosis, it leads to early intervention. But when you didn't diagnose a child early, or you didn't diagnose the condition early rather, you are not likely to give early intervention, which is important. And one thing is, the more you delay the child of getting early intervention, the longer the child stays in meeting up with many developmental milestones. So I'm using this opportunity to appeal one more time that as soon as you notice that your child is having a form of developmental delay or is not meeting up with developmental milestones, please go for developmental screening, and furthermore, go for a diagnostic assessment. Shun the misinformation out there. Shun criticisms. Shun whatsoever you are hearing. I mean, shun every other thing. Shun the stigma out there. And what? Go for a diagnostic assessment so that you can help your child early, so that you can help your treasure early. Thank you very much for listening. I'll see you again.